Bismillahirrahmanirrahim. So today we are going to talk about a very important topic, that is, if the oxygen cylinder or the oxygen source at the hospital has 100% oxygen, there is only oxygen in the oxygen cylinder and there is only oxygen in the supply of the oxygen given to the patient at the hospitals. Why we can't get 100% oxygen? We say that the nasal cannula gives the FiO2 of 40%. That means that the amount of air that we inhaling, that has only 40% oxygen. Rest is nitrogen and other gases. With face mask, that is 60%. I previously talked that how it is 40 and 60%. In the non-rebreather mask, that is 80 to 90%. Now here we will give the reason why we can't get 100% oxygen from the cylinder. FiO2 that we talk about, FiO2, that is fraction of oxygen in the inspired air. The fraction of oxygen in the inspired air. This is actually FiO2. Now focus on this. If we apply the nasal cannula to this patient, the person is inhaling from which sources? The number one source is this nasal cannula. Number second source is environment. The patient is also inhaling from the environment. You have applied the nasal cannula, so the patient is inhaling that air with 100% oxygen, but the patient is also inhaling from the environment. So the net amount of air that a person is getting is the mixture of both the nasal cannula coming from the cylinder and the air from the environment. So when these two combine together, the FiO2 of 100 from the oxygen, the 21% FiO2 of air, they combine together. 21%, that is 21% of oxygen in the air. This is not 100%. 100% of oxygen from cylinder both combined together to give FiO2 of 40%. I think that is clear. Face mask. In the face mask there are some pores for exhalation of air. Of course there is air coming into the lungs, but we have system to exhale our air so that we can expire and we can exhale all the air. So there are some pores. What happens in this condition? The patient is again taking oxygen from the oxygen source, and the person is also taking oxygen through these pores from the environment. But compared to the nasal cannula, we have fixed the environment to the nose. The amount of air from the environment in this case is more as compared to the amount of air from the environment in this case. The amount of air coming from the environment is less as compared to this. So here what happens? You have increased the FiO2. Again, the FiO2 of the atmospheric air and the FiO2 of the oxygen cylinder combined together to give you a combined FiO2 of 60%. Now coming toward the non-rebreather mask. There is a phenomena in the non-rebreather mask, and in a non-rebreather mask you are having a reservoir, you are having a bag in which the oxygen is stored. Now there is special system which allow only the air during exhalation, no air from the outside. There is no air coming. This is the one wall mechanism, allowing the air from the lung to enter into the environment, but no air is coming from the environment to the lungs. If there is no air coming from the environment to the lung, or very least amount of air coming from the environment to the lung, you have increased the FiO2. You have increased the FiO2. So this is actually the basic reason you cannot get the 100% oxygen from the oxygen cylinder and the oxygen source, because of mixing of the atmospheric air with that air. And how the mixing happen, I already explained. Now with the nasal cannula, you cannot give more oxygen than 6 liter. Why? The maximum oxygen that can give you the nasal cannula that we use in our wards, not the high flow nasal cannula. With the high flow nasal cannula, you can go up to 40 liter. But with this, because it produces a turbulence, and when it produces a turbulence, we cannot achieve our desired effect. And how much oxygen can we give with each of them, I already discussed in my previous lecture. And even if the person is not maintaining sets with the non-rebreather mask, next step is the CPAP or the BiPAP or ventilator. Thank you for watching.